So today we'll begin a simple primary care review on acute diverticulitis. Acute diverticulitis is defined as the inflammation of the diverticulum. It is microperforation of a diverticulum. Complicated diverticulitis is defined as diverticulitis with one of the following complications: bowel obstruction, abscess, fistula, or perforation. Clinical presentations: abdominal pain. The pain is usually in the left lower quadrant due to involvement of the sigmoid colon and constant. Nausea and vomiting, which is due to a bowel obstruction or peritoneal irritation. A low-grade fever, or a change in bowel habits, which includes constipation or diarrhea. Acute complications: abscess. Approximately 17% of patients hospitalized with acute diverticulitis. Obstruction. Partial colonic obstruction can occur because of relative luminal narrowing due to pericolonic inflammation or a diverticular abscess. Fistula or perforation, which is a rupture of a diverticular abscess in the peritoneal cavity or free rupture of an inflamed diverticulum with fecal contamination of the peritoneum. Laboratory findings: an elevated C-reactive protein and a mild leukocytosis. Serum amylase and lipase may be normal or mildly elevated, especially in patients with a free perforation and peritonitis. Urinalysis may have sterile pyria due to adjacent inflammation. Imaging: computed tomography scan. The presence of localized bowel wall thickening or an increased soft tissue density of CT findings suggestive of acute diverticulitis. Diagnosis: the diagnosis of acute diverticulitis should be suspected in a patient with lower left abdominal pain and abdominal tenderness on physical examination. Laboratory findings of an elevated CRP of greater than 50 milligrams per deciliter, leukocytosis, and abdominal imaging would be needed to establish the diagnosis of acute diverticulitis. Outpatient treatment: oral antibiotics for 7 to 10 days, follow up in 2 to 3 days, and then weekly until the complete resolution of all symptoms. These include ciprofloxacin plus metronidazole, levofloxacin plus metronidazole, trimethoprim, sulfamethoxazole plus metronidazole, amoxicillin clavulanate, and moxifloxacin. Thank you.